Hi everyone, welcome to my channel. In this video we are going to see about thyroid gland. It is largest and most superficial endocrine gland. It is largest and most superficial endocrine gland. Functions. It produces thyroid hormones T3, T4 and calcitonin. It produces thyroid hormones T3, T4, triiodothyronin, tetraiodothyronin and calcitonin. It regulates basal metabolic rate. It regulates basal metabolic rate. It stimulates psychosomatic growth of the body. It plays an important role in calcium metabolism. Thyroid gland produces thyroid hormones T3, T4 and calcitonin. It regulates basal metabolic rate, stimulates psychosomatic growth of the body. It plays an important role in calcium metabolism. Location. Where is the thyroid gland located? It is located anteriorly in the lower part of the neck opposite to C5, C6, C7 and T1 vertebrae. You can see the center is neck. It is present anteriorly in the lower part of the neck. It lies opposite to C5, C6, C7 and T1 vertebrae. Thyroid cartilage lies at the level of C4, C5 vertebrae. You can see that the thyroid gland is not extending up to the upper margin of the thyroid cartilage. It is extending only up to some extent of the thyroid cartilage. So don't consider C4, just consider C5. Thyroid cartilage corresponds to level of C4, C5 and the thyroid gland as it is not extending up to the upper margin of the thyroid cartilage, don't consider C4, just consider C5. And the cricoid cartilage lies at the level of C6. So remember, the thyroid gland lies opposite to C5, C6, C7 and T1 vertebrae. It lies behind sternohyoid and sternothyroid. Sternohyoid, sternohyoid, it extends from sternum to hyoid bone. Sternothyroid, it extends from sternum to oblique line of thyroid cartilage. The thyroid gland lies behind sternohyoid and sternothyroid. So what is the location of thyroid gland? It is located anteriorly in the lower part of the neck opposite to C5, C6, C7, T1 vertebrae. It lies behind sternohyoid and sternothyroid. Parts and features. It is H-shaped gland. You can see it is H-shaped. It is brownish red in color. It consists of vertical, right and left lateral lobes. The thyroid gland consists of vertical, you can see they are vertical, right and left lateral lobes. It consists of two lateral lobes, right lateral lobe and left lateral lobe. They are vertical. So it consists of vertical, right and left lateral lobes which are connected with each other through horizontal isthmus. Horizontal isthmus across the midline connects both the lateral lobes. Right lateral lobe and left lateral lobe are connected with each other through horizontal isthmus. Sometimes pyramidal lobe may be present. You can see the pyramidal lobe. It is an upward extension from the horizontal isthmus. You can see the pyramidal lobe. It is an upward extension from the isthmus. It usually lies left to the midline. If this is midline, it lies usually left to the midline. Pyramidal lobe is an upward extension from the isthmus. It usually lies left to the midline. Levator glandulae thyroidae. Levator glandulae thyroidae may be present in some individuals. It is fibrous or fibromuscular band. It connects pyramidal lobe to the body of hyoid. You can see levator glandulae thyroidae. It is fibrous or fibromuscular band. It connects pyramidal lobe to the body of hyoid. Extent of lateral lobe. It extends above up to oblique line of thyroid cartilage. Below it extends up to fifth or sixth tracheal rings. Lateral lobe. It extends above up to oblique line of thyroid cartilage. You can see that the lateral lobe is extending above up to oblique line of thyroid cartilage. Below it extends up to fifth or sixth tracheal rings. This is thyroid cartilage. Next to it, cricoid cartilage. Next to cricoid cartilage, first tracheal ring. And the isthmus lies in front of second, third, fourth tracheal rings, fifth tracheal ring, sixth tracheal ring. So you can see that below it is extending up to fifth or sixth tracheal rings. Lateral lobe, it extends above up to oblique line of thyroid cartilage. Below it extends up to fifth or sixth tracheal rings. Extent of isthmus. Isthmus lies across the midline in front of second, third, fourth tracheal rings. Isthmus lies in the midline across second, third, fourth tracheal rings. Let us revise parts and features. It is H-shaped gland. It is brownish red in color. It consists of two vertical right and left lateral lobes connected with each other through horizontal isthmus. Sometimes pyramidal lobe may be present. It is an upward extension from the isthmus. It usually lies left to the midline. It is connected to body of hyoid through the ventral glandule thyroidae, which is fibrous or fibromuscular band. Extent of lateral lobe. Above it extends up to oblique line of thyroid cartilage. Below it extends up to fifth or sixth tracheal rings. Isthmus, it lies in front of second, third, fourth tracheal rings. Weight. It weighs 15 to 25 grams approximately. Thyroid gland weighs 15 to 25 grams approximately. The thyroid gland is usually larger in the females. The thyroid gland is usually larger in size in females, and its size further increases during menstruation and during pregnancy. The thyroid gland is usually larger in the females, and its size further increases during menstruation and during pregnancy. Measurements. Each lateral lobe is 5 centimeters long, 3 centimeters wide, and 2 centimeters thick. Each lateral lobe is 5 centimeters long, 3 centimeters wide, and 2 centimeters thick. Isthmus, it measures 1.25 centimeters in both vertical and transverse diameters. Isthmus measures 1.25 centimeters in both vertical and transverse diameters. It weighs 15 to 25 grams approximately. Measurements. Each lobe is 5 centimeters long, 3 centimeters wide, 2 centimeters thick. Isthmus measures 1.25 centimeters in both vertical and transverse diameters. Now let's see about capsule of thyroid gland. The thyroid gland is invested by two capsules. It is invested by how many capsules? Two capsules. One is true capsule and the other is false capsule. You can see that true capsule is inside. Inner true capsule and outer false capsule. Inner true capsule, outer false capsule. True capsule, it is formed by peripheral condensation of fibrous stroma of the gland. True capsule is formed by peripheral condensation of fibrous stroma of the gland. False capsule. You can see false capsule here. It is derived from splitting of pretracheal fascia. False capsule is derived from splitting of pretracheal fascia. It is thin along posterior border of the lobe. False capsule is thin along posterior border of the lobe. As the capsule is thin along the posterior border, thyroid tumors tend to extend backwards. They project backwards and compress the adjacent structures, causing pressure symptoms. So, if there is any thyroid tumor, as the false capsule is thin along the posterior border, the thyroid tumors tend to extend backwards and they start compressing the adjacent structure. So, it may compress the esophagus, causing dysphagia, difficulty in swallowing. It may compress trachea, causing dyspnea, difficulty in breathing. So, these are the pressure symptoms due to compression by thyroid tumors. As the thyroid tumor is extending backwards, the patient presents with pressure symptoms without any visible swelling on the neck. So, as it is extending backwards, it does not produce swelling in front of the neck. So, the patient does not present with swelling on the neck, but the patient presents with pressure symptoms. False capsule is thick on the medial surface of the lateral lobe. The capsule is thick on medial surface of lateral lobe. Each lateral lobe has three surfaces. One is medial surface, lateral surface, and posterolateral surface. The false capsule thickens on medial surface of the lobe to form suspensory ligament of Berry. The false capsule thickens on medial surface of lateral lobe to form suspensory ligament of Berry. It connects lobe to cricoid cartilage. It connects medial surface of lobe to cricoid cartilage. Suspensory ligament of Berry connects lobe to cricoid cartilage. Above, it extends up to oblique line of thyroid cartilage and in the midline up to hyoid bone. Above, the pretracheal fascia extends up to oblique line of thyroid cartilage and in the midline up to hyoid bone. When the pretracheal fascia is traced below, it enters the thorax and merges with apex of fibrous pericardium. So the pretracheal fascia, when traced below, it enters the thorax and it merges with apex of fibrous pericardium. Let us revise capsule of thyroid gland. The thyroid gland is invested by two capsules, inner true capsule, outer false capsule. True capsule is formed by peripheral condensation of fibrous stroma of the gland. False capsule, it is derived from splitting of pretracheal fascia. It is thin along the posterior border of the lobe and it is thick on the medial surface of the lateral lobe. On the medial surface of the lobe, it thickens to form suspensory ligament of Berry, which connects lobe to cricoid cartilage. Above it extends up to oblique line of the thyroid cartilage and in the midline up to hyoid bone. Below it enters the thorax and merges with the apex of fibrous pericardium. In thyroid gland, venous plexus lie deep to true capsule. You can see here this is venous plexus. Venous plexus lie deep to true capsule. There is true capsule here and deep to it venous plexus. So in thyroid gland, venous plexus lie deep to true capsule. During thyroidectomy, thyroid gland is removed along with the true capsule to avoid hemorrhage. As the venous plexus lie deep to true capsule, during thyroidectomy, thyroid gland is removed along with true capsule to avoid hemorrhage. In prostate gland, venous plexus lie between true and false capsules. Thus, during prostatectomy, prostate gland is removed, leaving behind both the capsules. During thyroidectomy, thyroid gland is removed along with the true capsule, and during prostatectomy, prostate gland is removed, leaving behind both the capsules. Now let's see relations. Relations of thyroid lobe, relations of isthmus. Relations of thyroid lobe. Each lobe is pyramidal in shape. It presents apex, base, three surfaces and two borders. First, let's see about apex. It is directed upwards and slightly laterally. The apex is directed upwards. You can see it is directed upwards and slightly laterally. The apex is limited above by the attachment of sternothyroid. Apex is limited above by the attachment of sternothyroid. It is sandwiched between inferior constrictor medially and sternothyroid laterally. You can see here there is inferior constrictor. Here you can see sternothyroid. Apex is sandwiched between inferior constrictor medially and sternothyroid laterally. Apex is related to superior thyroid artery and external laryngeal nerve. Base. The base extends below up to 5th or 6th tracheal rings. It is related to inferior thyroid artery and recurrent laryngeal nerve. Apex is related to superior thyroid artery. Base is related to inferior thyroid artery. Apex is related to external laryngeal nerve. Base is related to recurrent laryngeal nerve. Base extends up to 5th or 6th tracheal rings. It is related to inferior thyroid artery and recurrent laryngeal nerve. Three surfaces. It includes lateral surface, medial surface, and posterolateral surface. Lateral surface or superficial surface, it is convex. Lateral surface or superficial surface is convex. It is covered by three strap muscles. Three strap muscles are sternohyoid, superior belly of omohyoid, sternothyroid. From within outwards, sternothyroid, sternohyoid and superior belly of omohyoid. It is covered by three strap muscles, sternohyoid, superior belly of omohyoid and sternothyroid. Inferiorly, it is overlapped by anterior border of sternocleidomastoid. You can see this is sternocleidomastoid. This muscle is sternocleidomastoid. Inferiorly, it is overlapped by anterior border of sternocleidomastoid. Next, let's see medial surface. The medial surface is related to two tubes. You can see one tube here, that is trachea, and the other tube is esophagus. It is related to two tubes, trachea, esophagus. Two cartilages, thyroid cartilage and cricoid cartilage. It is related to two muscles, inferior constrictor and cricothyroid. Two nerves, external laryngeal nerve, recurrent laryngeal nerve. Medial surface is related to two tubes, trachea, esophagus, two cartilages, thyroid cartilage, cricoid cartilage, two muscles, inferior constrictor, cricothyroid, two nerves, external laryngeal nerve and recurrent laryngeal nerve. Posterolateral surface, it is related to carotid sheath and its contents. You can see carotid sheath here and its contents. Carotid sheath contains common carotid artery, internal jugular vein and vagus nerve. Posterolateral surface is related to carotid sheath and its contents. Borders, two borders, anterior border and posterior border. Anterior border, it is thin. Anterior border is related to anterior branch of superior thyroid artery. You can see here superior thyroid artery. It gives anterior branch and posterior branch. Anterior branch of superior thyroid artery is related to anterior border of thyroid lobe. Posterior border, it is thick and round. It is related to longitudinal arterial anastomosis between superior and inferior thyroid arteries. Along the posterior border, there is longitudinal arterial anastomosis between superior thyroid artery and inferior thyroid artery. The posterior border is also related to parathyroid glands. Let's revise the relations of thyroid lobe. Apex, it is directed upwards and slightly laterally. It is limited above by the attachment of sternothyroid. It is sandwiched between inferior constrictor medially and sternothyroid laterally. It is related to superior thyroid artery and external laryngeal nerve. Base, it extends up to 5th or 6th tracheal rings. It is related to inferior thyroid artery and recurrent laryngeal nerve. Three surfaces, lateral surface, medial surface and posterolateral surface. Lateral surface, also known as superficial surface, it is convex. It is covered by three strap muscles, sternohyoid, superior belly of omohyoid and sternothyroid. Inferiorly, it is overlapped by anterior border of sternocleidomastoid. Medial surface, it is related to two tubes, trachea, esophagus, two cartilages, thyroid cartilage, cricoid cartilage, two muscles, inferior constrictor and cricothyroid, two nerves, external laryngeal nerve and recurrent laryngeal nerve. Posterolateral surface, it is related to carotid sheath and its contents. Two borders, anterior border, posterior border. Anterior border is thin. It is related to anterior branch of superior thyroid artery. Posterior border, it is thick and round. It is related to longitudinal arterial anastomosis between superior and inferior thyroid arteries, and it is also related to parathyroid glands. Next, let's see the relations of isthmus. It consists of two borders and two surfaces. Two borders, superior border and inferior border. Two surfaces, anterior surface and posterior surface. Superior border of isthmus is related to arterial anastomosis between anterior branches of superior thyroid artery. You can see the superior thyroid artery, it gives anterior branch and posterior branch. Along the superior border of the isthmus, there is arterial anastomosis between anterior branches of superior thyroid artery. Inferior border, along the inferior border, thyroidema artery enters and inferior thyroid vein emerges. Thyroidema artery, it enters through inferior border of the isthmus. Inferior thyroid vein, it emerges through inferior border of the isthmus. Two surfaces, anterior surface and posterior surface. Anterior surface of isthmus is related to sternohyoid and sternothyroid. Anteriorly, it is related to sternohyoid and sternothyroid and anterior jugular veins. Posterior surface, it is related to second, third, fourth tracheal rings. As the isthmus lies in front of second, third, fourth tracheal rings, the posterior surface is related to second, third, fourth tracheal rings. Let us now revise relations of isthmus. Two borders, superior border and inferior border. Along the superior border, there is arterial anastomosis between anterior branches of superior thyroid artery. Inferior border, along the inferior border, thyroidema artery enters and inferior thyroid vein emerges. Two surfaces, anterior surface and posterior surface. Anterior surface, it is related to strap muscle, sternohyoid, sternothyroid, and anterior jugular veins. Posterior surface, it is related to second, third, fourth tracheal rings.